Carolyn Lefkowits. I'm an assistant professor here at the University of Gynecologic Oncology in the Department of OBGYN, and I have a joint appointment in internal medicine in palliative care. When I was a resident and thinking about going into GYN oncology, struck by how the care of a woman with gynecologic cancer to me seems to be about much more than purely treating the cancer. I felt like I wanted to know more about the other elements of caring for a woman and her family affected by gynecologic cancer beyond purely treating the cancer. So treating the symptoms that come with cancer and its treatment, making sure that quality of life is the best that it can be during treatment and beyond. The way that I often explain it to patients is that, your oncology team is going to be focusing primarily on treating the cancer. And what palliative care brings is dedicated attention to everything that comes with that. So that may be side effects from the treatment. That may be symptoms of the cancer itself. That may be kind of the emotional weight on a woman and her family and friends and her support network of what it means to have a cancer diagnosis. Or providing extra attention for decision making at branch points in care, and making sure that we've really spent the time and energy to know a woman as an individual and her family, what her goals and values are, what her priorities are, so that when we have decisions to make in her cancer treatment, we can match those as best as possible to who she and her family are and what's most important to them. Patients with GYN cancers get their care here at the university. In addition to the symptom management and support provided by the oncology team, have access to a dedicated specialty palliative care team in both the outpatient setting in the cancer center and for folks that are in the hospital in the inpatient setting. And that is an interdisciplinary team with dedicated training in palliative care that includes a physician, sometimes a nurse practitioner, nurses, social work, chaplaincy, sort of a dedicated team designed to really focus on symptom management, quality of life, emotional and spiritual support. The similarity with hospice and palliative care is a focus on quality and a focus on comfort. But the difference is that unlike hospice, palliative care can be delivered right alongside treatment for the cancer itself. So while we're planning a big surgery, while a woman is getting chemotherapy in the middle of radiation, palliative care can be an and, not an or. An unfortunate misconception that we run into sometimes about palliative care is the worry that if we include palliative care, it will somehow be at the expense of the aggressiveness or the quality of the cancer treatment. And patients worry that we won't be as aggressive with treating their cancer if we're kind of worried too much about how comfortable they are or treating their symptoms. But in fact, the research studies would suggest that if anything, patients who are getting good attention to their symptoms, who are getting regular palliative care, live longer than patients who are not. And we know that the introduction of palliative care from these studies improves symptom management, improves quality of life, improves patient and family satisfaction with their care. And so overall, clinically, patients who have routine palliative care along with their cancer therapy actually do better.